Hi everyone, so learning about Lynch syndrome. Lynch syndrome is a hereditary cancer syndrome. It affects 1 in 400 people in UK, and it is a syndrome in which there is genetic predisposition to certain cancer. So the commonly cancers associated with Lynch syndrome, they are the colorectal cancer, where a part of your large bowel or the rectum can get involved. And then we have cancer of the inner lining of the womb, that is the endometrial cancer, ovarian cancer, stomach cancer, pancreas cancer, small intestine cancer, liver cancers. So these are some cancers which are associated with Lynch syndrome. This Lynch syndrome occurs? So normally we all know that our cells are made up of millions and trillions of chromosomes, and they carry genetic information. So there are certain genes which repair the damage in the DNA in our body. So when there is mutation in such genes, so the normal repair of the DNA cannot take place, and this abnormal DNA starts accumulating, and this can lead to cancers. It has an autosomal dominant inheritance, which means that even if one parent is having Lynch syndrome, then the chances of having Lynch syndrome to the baby is 1 in 2. So only one faulty gene is required for the condition to occur in the baby. So that is the meaning of autosomal dominant inheritance. So it's very important that if a female is suffering from Lynch syndrome, or if the partner is suffering from Lynch syndrome, they should have a proper genetic counseling from the genetic physicians and the counselors. So as I told regarding the common cancers associated with Lynch syndrome, how can we prevent these cancers? So if we are aware that we are one of the victim of Lynch syndrome, then we should go for regular colonoscopy from 25 years onwards at an interval of 1 to 2 years. Colonoscopy is a screening test which is used for the early detection of the cancers. So here a camera is introduced into the bowel to have a look at the inner surface of the bowel. Thereafter, for screening of the uterus cancer and the ovarian cancer, transvaginal sonography can be offered to the female till her family is complete, because thereafter we can offer her risk reducing surgeries. What are the risk reducing surgeries? So in a patient of Lynch syndrome, the risk reducing surgeries, we can go for total abdominal hysterectomy with removal of both the tubes and the ovaries once the patient has completed her family life. But before embarking pregnancy, this should be clear in her mind that if she or her partner, any of them, have Lynch syndrome, the chances of having Lynch syndrome in the baby is 1 in 2. So she should be hooked up with the genetic counselors and physicians for the same, or she can go for in vitro fertilization and pre-implantation genetic diagnosis. So that also should be counseled to her. Some of the other risk reducing strategies is giving aspirin. Aspirin is known to reduce the risk of colorectal cancers in patients of Lynch syndrome. The dosage which I found in literature, they say if the weight is less than 70 kg, 150 milligram. If it is more than 70 kg, we give 300 milligram. Thereafter, we should always screen for the H. pylori infection. We should be doing endoscopy every 3 to 5 yearly interval. And if there is H. pylori infestation, then proper antibiotics should also be given. So this is regarding something regarding the Lynch syndrome and how does the management goes. I hope it was helpful. So it should be a difficult news or breaking bad news station. We should give warning shots. We should be telling regarding the support groups, and including the counselors, and a multidisciplinary team involvement should be there. And the screening has to be discussed. The fertility issues have to be discussed with her. If we are talking about risk reducing TH with PSO, then what she will be having surgical menopause, regarding the further need for HRT. So all that has to be discussed in such kind of scenario. Thank you.